Hello, my name is Amber Lankford, and for my poli-sci presentation, I decided to do the topic Decrease Global Vaccinations. I am a nursing major at Bloomsburg University, and I'm going to receive my BSN in May of 2020. Why I chose this topic. As a nursing major, I find it important to have a healthy population. Unvaccinated populations lead to an increase in diseases, which lead to increased hospital stays and increased deaths. There can be a spread of diseases throughout communities if the population is not vaccinated. As a nurse, it is part of my job to educate others on the importance of staying healthy, which includes vaccinations and the importance of them. The importance of vaccinations. Many diseases that cause fatalities, such as measles, which has been spreading through the United States in the past years because of the lack of parents choosing to vaccinate their children, can be prevented if somebody is vaccinated. Herd immunity is also decreased when individuals choose not to be vaccinated. Herd immunity is when the majority of the population is vaccinated, so it decreases the chance of individuals who are immunodepressed or immunocompromised who can't receive vaccines. These are cancer patients receiving chemotherapy and radiation or patients with HIV. They rely on others to get vaccinated so diseases do not spread. According to the World Health Organization, immunization saves millions of lives every year and is widely recognized as one of the world's most successful and cost-effective health interventions. The World Health Organization posts statistics every year on their website. However, 2019 has not been posted, so these are for 2018. Globally, vaccinations are not up to what they should be. Only 72% are vaccinated with HIV, which protects people against meningitis and pneumonia. There are even some that aren't even getting diseases that aren't vaccinated, up to 50%. Only 42% are vaccinated against hepatitis B, and 35% are vaccinated against the rotavirus. About 19.4 million infants globally did not receive their recommended vaccinations in 2018. And around 60% of the 19.4 million live in underdeveloped countries. Out of all these statistics, this is very poor. The closer we can get to 100% of the population being vaccinated, the less likely disease will spread across the world. There are many barriers of vaccinating children. In developed countries like the United States, parents are scared of vaccinating their children. A couple years ago, a celebrity posted that vaccinations cause autism. However, this has been proven wrong by many studies. However, parents are still scared to vaccinate their children based on this fake news. In third world countries and underdeveloped countries, there is a lack of access to vaccinations. This is based on many reasons. It could be a decreased access to health care. And since there is a decreased access to healthcare, the cost of healthcare that is available could be expensive because of the limited quantity. There also could be a lack of transportation to healthcare. If the population lives in seclusion, such as jungles, they may not be able to get to where there are free vaccination clinics being set up. There also could be a lack of education about the importance of vaccinations. This is true for developed and third world countries. Global Vaccination Action Plan was introduced by WHO. They provide more access to vaccinations in underdeveloped countries by 2020. However, they did not meet the goal they want, so they will expand this past 2020. Through this action plan, they want to strengthen the governance and leadership of national immunization programs and improve monitoring and recording of immunizations so we can track who and when gets their vaccinations. They would also like to expand their immunizations in undeveloped countries past the infant immunizations. If you are in an underdeveloped country and going to be vaccinated, you most likely only got the infant immunizations. They would like to increase the school-aged and adult immunizations throughout these countries. They would also like to mobilize domestic funding. More funding means that they can give out more free or low-cost vaccinations across the world. There is also a World Immunization Week, and this is sponsored by WHO. It occurs the last week of April every year. The importance of this is to educate people on the importance of vaccinations. They can do this through ads on websites or articles posted online. This education is geared towards developed countries who would have access to internet. In conclusion, decreased immunizations lead to more deaths throughout the world. Access to immunizations and a lack of education about vaccinations has led to a decrease in vaccinated populations. To improve the rate of vaccinations, organizations like WHO can provide plans to increase access to vaccinations and educate the importance of vaccinations. Here is the reference that I used. Thank you for watching my presentation.